is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. Itasca County is holding press briefings weekly on Fridays at 10 a.m., focusing on themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. We are providing twice weekly written updates for the media. Today we'll focus on orthopedics, chiropractic, and physical therapy. As Governor Walz and his team have shifted to the Stay Safe Minnesota plans and tiered reopening of businesses and services, we are seeing the reopening of other health and preventative services. For our overall health, it is important to maintain our physical bodies and incorporate movement and stretching into our routines. Our speakers will further discuss their safe reopening and the importance of self-care, movement, and flexibility. We are joined today by a nurse practitioner in orthopedics, sports medicine, and wound care from Big Fork Valley, Dr. Diana Vidovic Kondos, owner and chiropractor at North Lakes Chiropractic, Dr. Eric Warren, chiropractor at Grand Itasca Clinic and Hospital, and Kelly Berry, owner and director of Progressive Care Therapy and director of physical therapy for Majestic Pines Senior Living. We will also have Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine physician from Grand Itasca Clinic and Hospital, Jean McDonald, President and CEO of Grand Itasca Clinic and Hospital, Angela Cleffman, Chief Operating Officer from Big Fork Valley, and Alicia Alleman from Scenic Rivers, their nurse manager, who will all be available for the question and answer portion. We are joined by our local and regional media. After our speakers, please submit questions via chat, and we would like you to preface your question with your name and the media organization that you represent, and our panel will respond to the questions that pertain to their organization. Before we move into our speakers, I will provide an update on COVID-19 numbers in Itasca County. We have 56 laboratory confirmed positive COVID-19 cases in Itasca County with other tests pending. The Minnesota Department of Health website will reflect this number within the next few days. Exposures include congregate settings, healthcare workers, domestic travel, direct contact with a known positive, and community spread. And when we refer to community spread, that means there's an unknown source of infection. We have unfortunately had additional deaths since our last media briefing. We have had 9 persons in Itasca County who have died from COVID-19. We express our condolences to the families and friends who have been affected, and we are taking this virus very seriously in Itasca County and are working with the community to minimize the spread. I will now introduce Jeff Temple, nurse practitioner, orthopedics, sports medicine, and wound care from Big Fork Valley.
Good morning, everyone. My name is Jeff Temple. As Kelly told you who I am, thanks for the nice introduction. Up in Big Fork Valley, the biggest thing, everyone, like everyone in the whole state and the whole country and the world is talking about COVID-19. It's a pandemic. It's an unfortunate thing that has happened. When you talk about anyone from the mental as well as the physical capability, people are going to shut themselves out. They're going to sit inside their house. They're going to be scared. That's going to go ahead and deal with mental problems in regard to, I'm going to be myself. I'm going to sit around the house, watch TV. When that happens, we really start to decrease our physical activity as well. So when you talk about orthopedics, the biggest thing with orthopedics, as well as the other providers will discuss, activity is motion. Motion is golden. We got to keep you active. We got to keep you healthy. In addition to that, going outside and getting some fresh air on your stoop, whatever you got to do, just to go ahead and get things back to normal to the best you feel comfortable with. In regard to Big Fork Valley, we have developed a pathway on returning back to orthopedic care. Everything is based upon the American Hospital Association as well as the Minnesota Department of Health. Everything and most important is patient safety. When we talk about here orthopedics at Big Fork Valley, we are here Monday through Friday, 8 to 3:30. When you talk about coming in for orthopedic, we have a plan. We do have a screening when you first come in the door, to the point where patients are staggered. They're staggered every 15 minutes because we cannot have a lot of people in a waiting room at the same time. Hypothetically, when a patient comes into a clinic appointment, they are brought in. They are brought right into the examination room after all the screening questions are completed. When patients actually make an appointment for orthopedic care, it's going to be for an acute injury. We see fractures. We go ahead and deal with musculoskeletal injuries. We refer people to physical therapy. When you talk about visitors that do come with any individual, we do ask that they stay in the vehicle unless you're under 18 and you need a guardian, or for some reason you need somebody with you as a durable power. Like I said, our biggest concern is in regard to patient safety. When you talk about universal masking, every employee here at Big Fork Valley has a mask. And when you take your mask off, basically go to eat, maybe get a drink of coffee, that's about it. In regard to surgical procedures, we are also starting to open that up for elective procedures. With the elective procedures, everything is based upon the American College of Surgeons. There is a scoring criteria based upon severity, but also to at risk. This is completed in addition to when people are coming in for surgery, we have on-site rapid testing the day of the surgery. We have a protocol in place to be certain that we know exactly where the individual is through the whole process. Individuals that come in for orthopedics, if they have some type of fracture, we do recommend that you follow the recommendations because we don't want you to not get better. In regard to wound care throughout this whole pandemic, we continue to do wound care in regard to individuals with chronic venous stasis ulcers, arterial insufficiencies. We see these on a regular basis. Myself, is it stressful? It's stressful for everyone. And every time we have a sunny day, it really brightens everybody's mood. Every time we get a cloudy day, it's going to depress your mood. So all I ask people to do when they come in is smile to the best you can. See their face, but you can see their eyes. When they squint, they're happy. And that's about all I have from my standpoint.
Thank you, Jeff. I will now introduce Dr. Diana Vidovic-Kondos, owner and chiropractor, North Lakes Chiropractic.
Hi there, Dr. Diana here. So what patients need to know about accessing our care, our Chiropractic Association has suggested we place importance in primarily seeing patients with acute musculoskeletal pain, the goal being ideally that we keep patients that could greatly benefit from chiropractic care out of the urgent care and the emergency rooms. We have been able to begin seeing more of our wellness-based patients, which does open up access to our patients. But ultimately, the health and safety of our patients continues to be the utmost of importance to us and the chiropractic profession. We will continue to widen appointment times to allow for heavy disinfecting in between each and every patient. We are limiting patient overlap between our providers and limiting walk-in type appointments. We continue to have PPE available, and then we've also continued to reserve our Monday morning early appointments for patients that are immunocompromised or who are high risk that would like to have less interaction with possible other patients at the clinic. Some ideas for self-care and general health. The International College of Integrative Health suggests it's important to the immune system to reduce things like inflammation. We can do that in a number of ways. The biggest thing that we have suggested to our patients is eating clean, eating foods that are clean, that are healthy, local, fresh, free of any sort of preservatives, pesticides, dyes, that kind of stuff. That's going to help properly. It reduces things like inflammation. Foods that are high in nutrients, such as vitamin C, vitamin A, vitamin D, zinc, and magnesium, are going to be things like kale, broccoli, spinach, peppers, avocados, berries. And then another good suggestion for maintaining health is reducing stress, both physical and emotional. So we've suggested a lot of our patients do things like stretching, yoga, deep breathing exercises. And then lastly, we've really put an emphasis on, exercise. For adults, it's suggested to get 30 minutes of exercise every single day, and for children, it's about an hour a day. Outside time is very important, so it's going to help us with absorption of vitamin D, and it just gives us the good feel, vitamins. We're asking patients, make a good effort to not sit in the same position for long periods throughout your day. Try to take a 3-minute break every half an hour. It's really hard to do, but it can really provide a lot of relief in terms of stress on both the body and emotionally.
Thank you, Diana. We will now hear from Dr. Eric Warren, chiropractor from Grand Itasca Clinic and Hospital.
Good morning, everyone. Thank you for more acute cases during this COVID crisis, we are beginning to resume care for both chiropractic as well as physical therapy, occupational, speech, and cardiac rehab. A lot of these services will begin resuming normal hours within the next week. We do appreciate everyone's patience while we are navigating this process. Much like Dr. Diana and as Jeff Temple are saying, we are following very strict disinfecting protocols, limiting patients, trying to get people right back into the rooms to avoid any waiting time. Also, too, we are deep cleaning patient rooms immediately before and immediately after every patient visit. And again, we are following universal masking procedures as well as any other personal protective measures. So as a chiropractor, again, we are here to help out with any neuromusculoskeletal health, relieving any symptoms such as pain, dysfunction, movement, things like that, where, as Dr. Diana said, trying to keep people away from emergency rooms, urgent care settings, things like that. Much, again, like my colleagues are saying, please, please, please get out, be active, enjoy the nice days. I mean, we do live in Minnesota, so get out for a walk, go for a swim if you can brave the water, do some yoga, even have fun with home chores, whatever you can do to be active. And again, please make sure that you do simple things like some general stretching or warm up before anything more strenuous, such as a run or lifting or anything like that. We are looking forward to being able to offer care for those again. Thank you so much for having me here today.
Thank you, Dr. Warren. Now we will hear from Kelly Berry, owner and director of Progressive Care Therapy and director of Physical Therapy, Senior Living.
There we go. Thank you. So just as all the other speakers have said, it has been a challenging time for everybody in the community and Minnesota and throughout the nation. We have as well put a pause on our services once this outbreak occurred and really been brainstorming safe re-entry to providing therapy services. We're excited to say that we have probably the second to third week in June, we're going to be reopening our therapy clinic for physical therapy and occupational therapy with some changes, just as others have said. The universal precautions as far as masking will be in place. One person per appointment time, directly assisted by a therapist into and out of exam areas. Sanitizing. Our aquatic center, we've got some interesting changes we're going to be doing there, but we are warming that pool back up to its 92-degree water and really looking forward to getting people back in the pool. You know, our emphasis here at Progressive Care Therapy with services at Majestic Pines is really serving that population that is challenged with whether it's chronic pain, back pain, hip, arthritic pain. Our pool offers a unique setting, so that really has been our challenge to figure out how to re-enter that to the community, provide that service again, and we're nearly there. So thanks for the patience, thanks for the understanding. Again, we do have a website. On our website, we put a YouTube channel link that we're putting our chair yoga, a general yoga class, a Zumba class, so that if you are disconnected from us, there's a way to stay connected by getting onto our website at majesticpinesmn.com. And you can click these links where our trainers and therapists have done recordings of their chair yoga, which has been so beneficial for so many people. And again, I just want to advocate again what everybody else is saying is stay active, get out, enjoy the weather. As we've had more screen time, we definitely are going to be seeing more kind of tightening of that forward, the front part of our body. So stretch your shoulders out, get your ears over your shoulders, squeeze those shoulder blades back. Posturally, just think about that throughout the day. And again, just be patient, but we are as excited as you are to reopen. So, thank you.
Thank you, Kelly. We will now move to the question and answer portion. We ask that the media submit their questions via chat and open with your name and the organization you represent. We have a question from Kathy Lynn from KOZY. Do you have numbers, testing numbers from the 3 facilities? We don't always readily have those available here in the health department, but I will allow the organizations to speak from that aspect. Alicia from Scenic Rivers said they've had 93 tests thus far at Scenic Rivers Medical Clinic in Big Fork. Jean, did you want to answer that from Grand Itasca's perspective?
Sure. We've done 1,081 tests so far on patients here at Grand Itasca.
Thank you. And we do not have a representative from Essentia Health here today. Kathy from KOZY, what about patients who have been waiting for things like knee surgery? How soon are these procedures available? Jeff, did you want to take that one from your perspective?
I sure can. Thanks for asking the question. When you talk about a knee procedure, it depends upon what type of a knee procedure. Are we talking about an outpatient knee arthroscopy when people tear their meniscus? How critical is it? Is it really affecting their lifestyle in regard to their inability to walk? In regard to artificial joint replacements, that is in the process. Hopefully in the next couple of weeks, we're going to start doing that gradually. However, based upon daily meetings among staff, how is the flow? In addition to is make sure we follow the guidelines, in addition to going back to surgery, and also how their medical history is.
Jean, did you want to add anything from Grand Itasca?
Yeah, thanks, Kelly. At Grand Itasca, we have started back up with our elective surgeries, and with our orthopedics group here at Grand Itasca, along with our other surgeons, we've been working through our backlog of cases, and we've been prioritizing them based on time and clinical need. So patients have already started to get rescheduled, and we're getting them back on the books starting at the beginning of this week.
Thank you. Are there other questions from the media? Kathy from KOZY, over the weekend, had an incident of slicing her hand on broken glass, went to the ER and felt perfectly safe, appropriate covering were being used, etc. How do you convey this safety to the public? Jean, did you want to start?
I will, yeah. You know, it's been kind of strange to have, you know, as time passes, the hallways have been empty and have finally started to feel a little bit busier here, at least at Grand Itasca. And I know at the beginning of the pandemic, the public, you know, was staying home appropriately. People were nervous about coming in. And we have tried to put out some messaging on our Facebook page and website to encourage folks to come in. Our emergency room is obviously open. And I do think, you know, just as time has passed, people are feeling more comfortable doing that. We are masking everyone who comes in. And I think that, as Kathy's saying, you know, once folks are in here, they can see that we have measures in place to keep people safe. And again, just with time passing, people have to come in for care. So, you know, I think that folks are seeing the disinfecting measures, the masking, and are feeling more comfortable coming in for the care they need.
Angela, did you have anything to add from Big Fork or Jeff at all?
Yeah, I would like to go ahead and say I agree 100% with Jean. Emergency is an emergency. And if you have like a cut to the hand, when you come in, we practice what we preach. We wear the masks, we do disinfection, we use the PPE. It's not only to prevent the transmission, but also protect everybody else. And then even when we're in the community, same thing has to, you know, proceed forward, wear your mask. But emergency rooms are available. If it's an acute injury, do not feel uncomfortable coming to either facility, because, you know, that's what we're here for.
Thank you. Other questions? Betsy Malene, do you have information available on the demographics of the cases, ages, and genders? We will look that up. The youngest case is, what I do know is the youngest case is an early elementary school age, and the oldest case is in their 90s. From Itasca County, we have posted social media some graphs related to those ages. Our highest age groups were in their 80s, but our 20 to 29-year-olds are very close in that same age range of the highest. Genders, I do not have that breakout readily available at this time. Other questions from the media? All right, seeing none, that will conclude our press briefing for today. Thank you, everyone, and stay well.